Hi everyone. I hope you're having a great week. I wanted to make this quick video for you with the questions being asked. So for my project, I'm going to be working in the outpatient specialty setting at Hawaii Pain Management Clinic. And I will be working, well, the target population are adults who are being treated for chronic pain. And the focus of my project is safe and efficacious use of opioids for pain management. As you know, there is a lot of controversy surrounding opioids for chronic pain because there are so many safety issues. Um, it's been recently called to attention in a warning from the FDA, I think just a couple of days ago. And in addition to that, the CDC had put out some guidelines because the issue is growing larger and larger. There are many preventable deaths that occur from poor management of opioid therapy. That being said, I do strongly believe that opioids have a role in medicine and in treating patients, and that if providers have the tools needed to prescribe and manage patients taking opioids, safely and effectively, then there's no reason that we shouldn't utilize it for improving function and quality of life, especially in the chronic setting, as opposed to more acute or outpatient setting. So as far as that goes, we don't have anything really concrete right now. Maybe some of you do, but we don't. I've been working closely with the team there to come up with some ideas, and it will probably be trying to implement the CDC guidelines that were just released, and also taking a lot of the evidence right now from other sources, which may or may not have been included in that guideline, and trying to hash out, okay, but what really is the most effective way to prescribe people with opioids more long term, while also being safe and ensuring that it remains that ensure that risk, does not outweigh benefit. So yeah, I'll also be working there, so that'll be good because I can kind of get my eyes on things and I can see what some of the issues are. I have a lot of ideas already, so I'm excited to get started. And so, switching gears, talking about leadership, I have limited leadership experience, and even then, only way back when in the military, when I was leading small groups of people, so just a couple of people. And some strengths I believe I have when it comes to leadership is that I'm fair. I do expect other people to be held to the same standards as I. And I also try to put myself in their shoes and understand, their side of things and when problems arise. And I was reading that that's positive leadership quality. Another strength I think I have is I'm very open to communication. I'm super receptive to feedback. I think that that's only beneficial, and I can, not be so rigid in my thinking. I like to, take ideas from other people, and I feel like, we're all working towards a common goal, that leaders should do that. But I have probably a lot of leadership weaknesses too, like I'm not always able to remain super organized, and that's one thing that I also wrote about in my discussion forum post this week. As far as the course goes, I'm not sure what to expect or what we're going to be learning. I've skimmed through some of the readings, but I'm just hoping that, I can apply it readily to the project in terms of implementing the project at the project site. I want things to go smoothly, so I know that that's going to require leadership qualities. And I think that the course would be very beneficial for me in that respect. there's not much else more. With all that being said, I hope everyone has a great term and a great semester rather. And if you have any questions for me regarding my project or some input or feedback or even some good sources that you see regarding opioid pain management, hit me up on email. And I'd be glad to, I really appreciate it. I hope you guys have a great weekend. Take care.